Thank you for the introduction. I will present on social protections and COVID-19 in Latin America, drawing on a co-authored report that we recently published just a month ago with Sepal-Eklak. So I'll give you some background and then talk about the measures that governments have taken since COVID hit. So very briefly, a little bit of background. Social protections pre-COVID in Latin America, and this, some of you will probably know this very well, but just for those of you who are not Latin Americanists, Latin America is known for being the region with the highest economic inequalities in the world. Also, Social Security covers only a small share of the employed population, about a half of the employed population, and those people that it covers already tend to be better off. And here's a graph showing this across the 10 countries included in our ECLAC study, and it also shows the levels of formalization per quintile, and so it shows the difference between 80% of the population in Uruguay, employed population being in the formal sector, versus 20% in Peru and Bolivia, but also the vast differences by income quintiles in this highly unequal region. Because of the inequality in reach of Social Security, soon after democratization, about 25 years ago, Latin American governments moved to try to cover all those families and households that were basically left out in the cold from Social Security. And many of you may have heard of the policy innovation of focusing especially on families with children in poverty who are often most hit by poverty. And basically giving families in extreme poverty small cash transfers monthly, and of course, probably know Bolsa Familia, the biggest program of its kind in the world, Oportunidades in Mexico. These started in the late 1990s in Latin America, spread rapidly through the region, and also globally, and they were considered very innovative. And what they did was give money to mothers with the idea that mothers spend it on children, and the empirical evidence that they do, and also because mothers were seen as the primary caregivers, and they linked them to conditions such as getting the kids vaccinated and going to school. They were very effective in that, in reducing malnutrition, increasing school attendance rates. However, they still did not reach many people, especially when you think about the high levels of poverty in the region. And this shows you briefly the coverage and sufficiency of anti-poverty cash transfers to children right before the pandemic hit. And what this shows is that this blue line is the share of the under 18-year-olds who are covered in these anti-poverty programs. So let's take the example of Chile, for example. 42% of Chileans are covered in the anti-poverty program. The blue bars represent the amount of money that these families received in a typical family of 2 adults and 2 children per household member as a share of the national extreme poverty line. So if we assume that, for example, in Chile, the extreme poverty line is 100 euros a month, then Chileans who are in the program got about 16 euros a month. And so it didn't, neither did it reach that many children, nor was it particularly sufficient, which basically meant that half of the children in Latin America, when the pandemic hit, lived in poverty. And so you can really see the age distribution of poverty here. And so 46% of 0 to 14-year-olds in Latin America were in poverty already pre-pandemic, and it gradually decreased to just 15% of those 65 years and over. And what this means is that when the pandemic hit, well, the elderly were obviously epidemiologically most at risk of the pandemic. Children and families with children were especially at risk socially, with the effect, especially the economic effects and the lockdowns that the pandemic produced. And this gives you just some information. This is from our own elaboration, Luxembourg income survey data about the type of household by income quintile. And so the poorer you are, the more likely you are to have children in the household is the basic message of this graph. So COVID-19 strikes, and Latin American governments move into lockdowns and social distancing is starting mid-March. They also moved to provide economic rescue packages, and I believe that my colleagues, economists, will talk quite a bit about this, and moved to also provide social protection measures. because of course the problem is that when you move into lockdowns and social distancing and the attendant economic crisis for over half of the population that survives, or about half the population that survives off the informal sector, that basically means that your income might dry up overnight. And if you still need to feed your families, you need income assistance. And so here, basically what we do in our ECLOC study, we look at post-COVID income protection and cash transfer measures for three groups. Those in traditional contributory social security, those in the non-contributory programs, the anti-poverty programs I just discussed, and then finally the third group that falls in between both of these groups, that are informal households that are neither part of the traditional contributory social security, nor are they poor enough or vulnerable enough to qualify for the non-contributory social security programs. However, they tend to be very vulnerable, and most of them live about 1.2. Most of them are under 1.2 poverty lines in their countries. Then we look at the dimensions of policy effort the governments make. Speed. If you have a family to feed, you need food fast. Breadth. What percentage of people who need aid are covered, and sufficiency of those transfers. Do they actually allow families to cover their basic necessities? So I'll summarize briefly the results of this survey, and then I'll make some general comments about implications and causes. So the speed, and this is the 10 countries we looked at: Argentina, Chile, Peru, Bolivia, Brazil, Mexico, Colombia, Ecuador, Uruguay, and Costa Rica. By the end of March, out of these 10 governments, 7 had pledged additional cash assistance via the existing conditional cash transfer programs. All governments had to establish some form of labor or income protections to formal sector workers. However, there was tremendous variation in the types of protections as well as the amount of subsidies that were provided. By the end of April, 9 out of 10 governments had pledged income assistance to at least some informal households, those that fell in between the cracks of these other two systems. 7 of these 9 established more inclusive, what we refer to as demand-driven mechanisms that basically allowed households in need to self-identify and apply. 2 of these, Ecuador and Colombia, maintained restrictive supply-side eligibility criteria, where they basically identified the beneficiaries according to databases they already had. Basically, don't call us, we'll call you. Mexico did not institute a national-level income assistance program at all. By the end of June, a significant share of first-round recipients had received some aid. But that's a long time to wait. That's like 3 months. And if you're a family in need, waiting for 3 months after a crisis hits is pretty difficult. So in many countries, a slowness was a huge problem. Delays were caused by both political and technical factors. On the one hand, some of the executives were quite slow to recognize the extent of need. Second, in some cases, the executive recognized the extent of need, but Congress didn't want to authorize massive budget increases. For example, in Costa Rica, they delayed it, although finally they authorized it. In Ecuador, they didn't. And then you had these challenges related to state capacity, implementation, delivery, problems with databases, electronic mechanisms crashing, errors of inclusion and exclusion. So here is a summary of the data on the increased amount given to families in existing programs since March. And what this is the same graph as before, okay? But what you want to look at is the blue, dark blue bars. And this indicates the increase in transfer amount that was given to a typical family of 2 adults and 2 children in the first 3 months. Full months after COVID. And so we did a summary of like an average of the first 3 months. And you can see here that in the cases of Chile, Brazil, and Argentina, governments eventually increased the transfers quite a bit to the extent that they went above the extreme poverty line. Other countries such as Peru and Bolivia, taking into account especially that these are poor countries, also increased quite a bit the sufficiency of these transfers for those who are already in the existing programs. And of course, you can see here that Peru, the coverage of the existing program was small. In Bolivia, the coverage was higher but the amount was smaller. Colombia did a little bit, and there were other countries like Ecuador and Mexico that did not use these existing mechanisms to provide more aid. Then, on the other hand, there's a significant effort in creating new policies toward these informal households. And this graph gives you the coverage on that. So the bars are not sufficiency, they measure coverage, and I'll explain it to you. This tries to summarize a lot of information. The gray line is the share of employed workers who are informal, i.e. not contributing to Social Security, according to the latest available data, IADB 2018. Okay, so this gives you a proxy of the rough extent of need of reaching informal households. And the red bar is the number of new transfers or share of new transfers going to informal people. So again, ones who are not in either existing program, as share of total employed population as of 2018. Okay, so this gives you a rough proxy of the reach and the need of these new programs. And here you can see that Brazil and Argentina reach the population that ostensibly falls through the cracks. Brazil quite significantly above the actual, but of course here this is the employed population in Brazil. The transfers were also given to mothers who were not necessarily in the paid labor force, and other groups in society who were very vulnerable. So this is not necessarily a reflection of errors of inclusion, the reflection of the extent of need. Bolivia also. Peru quite extensively was able to cover, but not completely, need. Ecuador and Colombia, here you can see the big gap left by their supply side mechanisms, and Mexico stands out as providing no coverage to households, informal households in need. In sum, you have a massive variation in policy effort, both breadth and sufficiency. Some of the effects, and perhaps the other panelists will also talk about Brazil. On the one hand, you have the case of Brazil, where a massive income transfer program, again, it should be pointed out that this was not actually a program by the government. It was proposed by the opposition, passed in Congress unanimously, after which the government signed it into law and implemented it. And now is receiving some credit for it. But by July, extreme poverty in Brazil had declined to the lowest level in recorded history. On the other extreme, we have Mexico, where by September, a UNICEF survey reported that 80% of households with children were not able to meet basic nutritional needs. So the implications of these differences are huge. Causes. This is what I'm actually working on right now with two co-authors in political science. It's interesting because our existing theories don't help that much. For example, political ideology is not a predictor of coverage of vulnerable populations. Policy legacies, threat of social mobilization, and legitimacy struggles are providing some clues towards that. Implications more broadly, one thing that we're investigating now, very importantly, is the duration of transfers. We know this crisis isn't going to be over anytime soon. And the key issue is now, are these temporary or will a broader social protection floor be forged? The sufficiency of the transfers is already being cut into half in Brazil. The question is, will they continue beyond the new year? And that's also a question for the other countries that have created these transfers. And finally, we're looking at this in terms of the impact that sometimes massive external economic crises can have in forging sort of critical junctures and potentially new social protection floors in the region. So I'll stop talking here. Thank you very much. I very much look forward to your questions.